Live.
Hello everyone, my name is Michael Brooks. I'm the Vice Chair of the Sullivan County Legislature, and on behalf of our Chairman, Rob Doherty, and the rest of the Sullivan County Legislature, welcome to today's Town Hall. With me today is our County Manager, Josh Potosik, our Public Health Director, Nancy McGraw, and our guest today is Megan Galligan, our DA. We're going to start today with Megan. She is going to talk about some of the COVID-19 scams and just overall about her office and what her office basically has been dealing with during this pandemic. Megan, welcome.
Thank you. I want to thank Chairman Doherty, Legislator Brooks, and our county leadership team for having me with you today. The Office of the District Attorney is responsible for every criminal prosecution in Sullivan County. To that end, during this crisis, we remain dedicated to law enforcement and to keeping you safe. Our assistant district attorneys are working remotely, and we've worked to equip every local law enforcement agency with technology so that we can conduct virtual arraignments, and we're moving toward more virtual court proceedings. I'm here today to talk to you about some scams that you may see in light of the COVID-19 crisis and what you can do to protect yourself, your family, and your neighbors from falling victim. Although scams are not unique to COVID-19, they can easily be modified to fit our current crisis. Remember, all scams rely on the scammer getting paid. My simple advice is this: if someone you've never met in person asks you to send them money, a Western Union, or a green dot money card, that's a red flag. You're probably being scammed. If you get a call from a relative or friend, maybe one that you haven't heard from in a while, and they claim to be in jail, especially in a jail that's far away, and they need bail money, be aware you're probably being scammed. If they ask you to send them money again, as we said, by Western Union, green dot money card, or other cashless form, you're likely being scammed. If someone asks you to send them a check or a money order back after mailing it to you and you cashing it, that's a red flag. You're probably being scammed. If you get a call from the electric company claiming your electric bill is not paid and they're going to shut you off unless you give them a credit card or green dot money card, you're probably being scammed. If someone calls you from the IRS or sheriff's office and tells you there's a warrant for your arrest because you owe back taxes, you're probably being scammed. In short, do not give out your social security number, date of birth, bank account number, credit card information, or any other personal information to anyone you do not know. Do not answer any questions about your federal stimulus payment over the telephone, by email, or by text message. Ignore offers for COVID vaccinations or test kits. Hang up on robocalls. Do not click on any link sent to you by email or text message relating to the coronavirus, the federal stimulus, or loan repayment assistance at this time. Never provide your social security number, bank account information, or any other personal information over the phone or on the internet by any link that you have clicked on. Remember, if it sounds too good to be true, it is. Unfortunately, once you've provided your private information to someone or sent them money, the damage is done. Reach out to a loved one, to your local law enforcement, or to the state police if you think you're being scammed. We're here to help. Thank you.
Thank you, Megan. Now, before we get started with our Q&A section today, I just want to mention that today we were going to roll out our new map with some new details on it. Unfortunately, that map is not quite ready. We want to be able to get it right and accurate. We're not quite there yet. We apologize for that. But it will be ready tomorrow. And when it is, our Communications Director, Dan Hoost, and our Public Health Director, Nancy McGraw, will have a video available explaining the details of the map. Now, to get started, as you always do, first question goes to Nancy. What are the latest figures, confirmed cases, people currently hospitalized, people currently recovered, people who have died, and how many tested?
Good afternoon. As you can see, we've slightly revamped our dashboard, and we have a little bit of a different way of portraying the data. Over the weekend, we had an additional 33 cases, so we are up to 560 total confirmed. Of those 560, only 265 are actively sick, and 630 have come off of isolation. And I'll address that question later. We have a question about what does being off isolation mean. We're holding steady at 13 deaths of county residents from COVID-19. 873 have are still on mandatory quarantine, and those are people who have been directly exposed to someone who was positive. In addition, 2,450 individuals have been tested. Now that 33 may seem like a big jump, but we're talking from Friday to today. So that's an increase of, we had 18 additional cases on Saturday, 8 additional cases on Sunday, and 7 additional cases this morning. And we check those results in those labs twice a day. So you will see the numbers continue to go up slightly. We are seeing a slight decrease with the exception of our adult care center, which we did notify the public of that on Friday last week.
Thank you, Nancy. Next question also goes to Nancy. Like the rest of the nation, Sullivan County will not reopen without mass testing, just like the rest of the country. Ulster County and Orange County have had drive-through testing sites for weeks. Why don't we yet? And why have testing done at doctor's offices, which isn't as safe due to potential spread of coronavirus?
Drive-through testing has been explored by Sullivan County with our state health department resources and contacts. Initially, drive-through testing was being done at some of the more metropolitan areas and still continues to do so. But those drive-through testing sites have really seen a decline in the number of people being tested. Drive-through testing was tried in Ellenville, but because they didn't have enough individuals and enough kits to make it worthwhile, they brought it back into the hospital. They're still doing testing there in their tent outside the hospital, which is the same thing that our Catskill Regional Medical Center is doing. So that is accessible. There's a state-run facility at the Anthony Wayne Recreation Area near Bear Mountain in Orange County. Keep in mind they also have 5 times the population that we have and more than 10 times the number of cases that we have in Sullivan. They're in the thousands and thousands, I believe almost 6,000 cases or more. I haven't looked recently. There's a shortage of testing supplies nationwide and in the state, and we completely understand that large quantities of tests must be made available in order for us to safely reopen schools and businesses. We have been letting the state know that we need access to testing supplies just as urgently as downstate counties in order to protect our residents. We did receive an additional 100 test kits yesterday through the Office of Emergency Management, but we need much more. We're going to be working with our communities to plan and identify which are the best locations possibly for those most impacted who are underserved and do not have access to health care in order to have targeted testing. Testing remains to be done at the local doctor's offices, which is safe. All of the doctor's offices who are currently doing testing have long ago put safety practices and procedural practices into place in terms of protective equipment, PPE, and distancing, and will actually do it outside the office in most cases. Hudson River Healthcare has increased their testing capacity, as has Crystal Run Healthcare and some other providers that are doing testing.
Thank you, Nancy. Our next question is also for Nancy. On your dashboard, can you include additional data of the new positive cases? For example, if we have a large spike, could you have lists saying 34 people in, say, a nursing home, 4 employees, or a 3-person family group, etc., to explain the large spikes?
We have been working with the dashboard to provide as much information as possible and to make it useful and transparent to the community. We've also been very transparent with our county-run nursing home and provided information last week and initially when we saw an increase in cases, and will continue to do so. We will not provide data that is small in numbers and specific to individuals or small groups of individuals in order to protect confidentiality.
Thank you, Nancy. Next question also goes to Nancy. Can you include data on businesses that had employees with positive cases, particularly frontline employees? Should that business include a clear sign stating that before people enter that business? That was how it was worded.
We've been reaching out to essential businesses from before the beginning of this pandemic showing up in Sullivan County, and we will continue to do so. We're reaching out to essential businesses to make sure that they understand the practices that they should be putting into place. We've seen an improvement in many of these locations. There are some essential businesses that we are getting complaints about that we have continued to reach out to, both through public health, through management, and also if there are any positive individuals working in specific businesses, we always reach out to these individuals and provide them with information that they need in order to stay safe and healthy. So we are continuing to do that. We will not provide information on businesses that have positive employees in specific locations. As long as the numbers continue to be small. Rather, we are working with these businesses to ensure that everyone is safe as possible, that employees are not going to work sick, that they have the resources they need if they need to stay home on quarantine, and that essential businesses are monitoring their employees every day in terms of any signs and symptoms of illness, and that they have sanitation practices and masks available for their employees, and we'll continue to do that. We also will partner with Ag and Markets and with law enforcement if we find the need to do so to make some site visits.
Thank you, Nancy. Our next question, we're going to ask Megan to answer. Should convenience stores or any other business really allow people to enter without wearing a mask?
We encourage everyone, from business operators to the general public, to wear a mask whenever you expect that you may be within 6 feet of another person. Our public health director, our county leadership, and your local law enforcement are engaging in active education of individuals when specific concerns are raised with respect to violation of the governor's executive order. It is best practice to wear a mask or another face covering when you are out in public at all times until we can be assured that this crisis is under control. If you have specific concerns, you can always reach out to New York's PAWS hotline or directly to your local law enforcement agency. We're here to help and we're here to educate.
Thank you. Next question goes to Nancy. What would we do without Nancy? And by the way, thank you, Nancy, for everything you've been doing. Large appreciation, goes without saying. The dashboard lists off isolation recovered. How is that determined, and how are people tested again before you add them to that section?
I want to say thank you to our whole team. We have a huge team at Public Health who is really doing the lion's share of this work on a daily basis, working really almost 24/7, and also the county leadership, and without whose assistance and help we really could not be doing all of this. In terms of the number of people who have come off of isolation, it's 630 individuals as of today. Now that number will never match up with the total number of people tested or on quarantine. That number will go up and down depending on the time period from which they became tested positive until the end of their quarantine. So if someone's on isolation, that means they tested positive and they were experiencing symptoms of illness. Those individuals, 630 as of today, are off of isolation and are doing much better. That's how we define that. In terms of recovered, we do know that some of the symptoms can go way beyond 2 weeks from what we're hearing. And so we continue to encourage people to self-monitor their signs and symptoms, to call us back. If they experience ongoing symptoms, to call their healthcare provider, to really let us know what's going on. So it's a huge task for our staff, and we want everyone to make sure that they know that they can contact us even after they've been off of isolation.
Thank you, Nancy. Next question also goes to Nancy. Have you reached out to any of the hospitals to start any clinical trials of COVID therapeutics? For example, remdesivir. A doctor is leading a trial of that at Montefiore.
We've reached out to Catskill Regional Medical Center, and they are in the process of giving us more information. I know that Albany Medical Center is doing some antibody testing. Some other hospitals will be doing that. We're waiting to get more detailed information from the State Health Department on which hospitals in our region and in the state are doing a variety of different experimental trials. Again, this is all experimental, and if a trial is not been FDA approved, it's really a medical research issue, and so the hospitals are proceeding very carefully and cautiously, but from my understanding, in some instances throughout the state have experienced success with different types of treatment.
Next question also goes to Nancy. Have you started contact tracing, and will you provide that information to the public? This information could be helpful for slowing the spread. The public can call the county to report being in an area at the same time as someone who tested positive, and can tell you if they come down with mild symptoms. It could also inform people that could be asymptomatic to stay home.
We, like other counties, have been looking into some various technology in terms of contact tracing to make it easier and to make it less workload burdensome for our staff. Please keep in mind we do have a very small staff, but that's not really the issue. The issue is the volume in terms of the work that's involved in contact tracing. That's been something that is a hallmark of any disease outbreak in terms of public health investigations. Contact tracing is something that we've done from the very beginning. That is protected information because it's based on individuals who have tested positive and who they were in direct exposure with. Many times that can be family, friends, co-workers, or it could be some member of the public. So that's a huge lift in order to do the investigations and contact tracing. It's a lot of work, and it's not information that would be necessarily valuable to the public unless there was an exposure in a large public area or workplace where we needed to make that notification to the public, but we won't do that on a case-by-case basis.
Okay, our next question goes to Josh. How are we protecting vulnerable populations in Sullivan County? Example being the poor, uninsured, undocumented, factory workers, inmates, those admitted to the behavioral units in the hospitals.
Good afternoon. So county governments in New York State are, even absent a pandemic, are charged with representing and supporting some of our more vulnerable population. We have a Department of Family Services that deals with the poor, uninsured, undocumented on a regular basis. They're still fully staffed. They have a lot of people working at home, but they do have a presence in our Liberty building. We would ask that you would call that department before showing up looking for services, and some of the services that they can provide, this vulnerable group as temporary assistance, food stamps, and if you have a housing crisis, they're there to help support and find and fill in those gaps for you at this time, and like they do in normal times as well. We've also opened up the Emergency Community Assistance Center that's been staffed and is there to help people with food insecurity, medicine, and other necessities. That's also our volunteer portal, providing deliveries of food for those that are quarantined or isolated that can't leave their house, and also looking at PPE donations as well. So those two entities are kind of still fully functioning at this time to help those in need.
Next question also goes to Josh, and it's a long one. The list of county positions being laid off includes 3 addiction staff, 2 mental health clinic staff, and 2 probation officers. Have you not considered the significant impact this pandemic is going to have on mental health and substance abuse before making such a decision? Also, with the bail reform law already putting a strain on the probation department, have you not also considered how the pandemic will ultimately affect the department? Increased substance use leads to increased crime. Financial insecurity leads to increased crime. What do you plan to do as soon as possible to address the huge impacts of the county in these positions, if these positions are left unfilled?
Obviously, last Thursday, we were forced to take the unfortunate step of having to look at even temporary layoffs. Not something I relish or looking to have to make those recommendations, and likewise the legislature having to make those tough financial decisions, looking to shed cost, as we're going to have certainly a rocky revenue economy going forward with sales tax reductions and potential state aid reductions that are going to be in the millions. We're looking at a goal of looking at about a $9 million reduction of expenditures to offset reductions of expenses. I think the legislature went a long way in addressing that last week, looking at about $6 million of expenditures savings. So I think we've kind of made unfortunately, the prudent fiscal decisions to kind of keep county government functioning. Obviously, that came with even some temporary layoffs. So in general, we were kind of, without going into specific departments, looking at, obviously, departments have workloads have kind of greatly reduced in certain areas that aren't dealing with this pandemic. That was kind of where we were looking at, and also not having the employees be financially harmed during this temporary layoff. So we're looking, have a goal at the end of July to bring the positions back. That does not mean, depending on workloads increasing, that we would not consider bringing some of these positions back in May or June before the July deadline. So we will be continually monitoring every department and the staffing reduction to see if they can continue to meet the bare necessities of operating their departments. If that turns out to be untrue, I will ask the legislature to reconsider creating certain positions in certain departments where that they cannot function.
Thank you, Josh. We as a legislature, just addressing this for a second before we move on, that there was a lot of deliberation and there's a lot of thought going into this. There is not a book written about this. This is uncharted territory, and our compass is basically the good decisions, looking at the data, not wanting to harm any individual. And we think we put a responsible package out there for folks, and I hope you'll agree. We hope that in 3 months that we'll be past this, where we can start to think about bringing people home. We as a county are covering your health, so it's very important. We are a family, and we take that very seriously. Moving on to the next question. It's also for Josh. Has the county considered activating the emergency text alert system, similar to an Amber Alert, to inform people about mandatory public health safety protocols?
So obviously, this is something, a technology tool that we seriously looked at and are continuing to look at. These types of notifications are more of think of a simple sentence text, getting basic information out in an emergency, evacuation orders in times of floods and other severe weather events where brevity is important. Obviously, the complexity of this pandemic has had us look more at more in-depth messaging, whether the town halls, websites, detailed press releases, to kind of get as much information out as possible. So it's something we continue to look at using this type of technology, and we're not ruling it out in the future. We just feel it may be a blunt tool with what we're facing as such a complex pandemic.
Thank you, Judge. Okay, the last question I'm going to address, and it's the question reads: could you show the proper way to put on, wear, and take off masks? I see people wearing them only over their mouth, touching the inside outside of the mask, possibly cross-contaminating if they put it in their purse, pocket, or counter, etc. Nancy is going to, is it going to be sometime within the next day or two putting out? Okay. Okay. Nancy is going to be putting a video up on our Facebook page demonstrating the proper methods to put a mask on and take it off and the proper handling. We look forward to that, Nancy. A couple things before we close. That does it for our questions today. And by the way, thank you for everyone who submits their questions. Hopefully, the legislature thinks that this is a great opportunity just to share information to the residents of Sullivan County. Last meeting, I mentioned the importance of census, and want to reiterate today that if you haven't already, please submit your information on the census for 2020. It's very important. The last go round, Sullivan County was, I believe, just right at the bottom. I think there was one county worse than us. And all returns thus far, we're in the same boat. Please take the time and submit your census. It's very important. There's a lot, it's representation, it's state monies. There's a lot associated with the census data. So please take time out and fill that out for 2020. And in closing, I'd like to, this weekend I was driving with my daughter, and, we're just thinking about her life and just things around us and how people have been living their lives in light of this pandemic. And the virus, obviously, it's resilient and it's adaptable, but we too are that. And it's something very important to keep in mind, that through good decision making, we can make a difference. And, I mentioned to my daughter that it's not a matter of if, but when another challenge will come in her lifetime. And I think especially for the younger folks that are listening today, that there will be challenges, whether it's personal or societal. It's going to happen. It's inevitable. And just to observe what's going on around you, acting and reacting. But also, part of that is remembering what came before, remembering how people acted and reacted. And I think then you can actually go about living and not be afraid. This is unfortunately part of life. And I think if you observe and remember the past, and you can live and live to the pursuit of happiness, as it's stated in one of our founding documents. I think it's so important. So please just remember that there's no substitute for good decision making, doing the right thing, keeping your distance, and we'll get through this sooner rather than later. With that, be safe, have a good afternoon. Bye for now.